The next question is question 5. We move on to the next question, which is question 5. It also says to explain what circumstance can lead to miscarriage. So the circumstance which can lead to miscarriage, the common ones could be chromosomal abnormalities, also hormonal imbalances, maternal infections, chronic diseases, placenta problems, exposure of drugs, maybe if the mother is exposed to the drugs, alcohol, or any toxins. Then also age also matters. If maternal age is over 35, there's a bit of some complication. And then we have also the maybe trauma or severe malnutrition. Those are some of the circumstances that can lead to miscarriage. And then we have the sixth question, which says describe, I think, the IVF can be used to help. I think the IVF which is this happens when the parent cannot conceive naturally, and then they will get the ovaries and stimulate them and produce multiple eggs, and then the eggs are removed and fertilized in the lab or with a sperm, and then the embryos grow to the blastocyte stage, and then when the embryo grows to the blastocyte stage, a healthy embryo can be gotten or selected and inserted into the uterus of the mother and or whoever is carrying the child, and later on the pregnancy will start growing. And then so this is helpful, especially to mothers that cannot naturally conceive, or they have blocked fallopian tubes, or the other spouse has a low sperm count, or any infertility or genetic issues. And then it also can increase chances of pregnancy when natural conception is difficulty, like I said. And then the last question is about explaining the pregnancy test, like how the pregnancy how the pregnancy tests work to detect the pregnancy. So the pregnancy tests detects the HCG. That's what the pregnancy tests tests. So the HCG is produced by the trophoblasts after implantation, and then the urine or blood tests use the antibodies that bind to the HCG. So if the HCG is present, it will produce a visible line or a positive symbol. When the rising of HCG confirms the rising of HCG levels confirm early pregnancy. So that's how you can test and detect pregnancy, when the HCG is present. Thank you.